With Omicron having infected a stunning number of Canadians, the pandemic picture is changing.
We think that we hit the peak of community transmission in British Columbia.
Quebec is saying that too. Nationally, federal health officials are now predicting infections will peak across Canada within weeks.
I think the next week is actually quite important
to suggest that.
But experts caution.
If people misinterpret that to mean, well, everything's fine, let me have a large dinner party with 15 of my closest friends, that's going to be potentially problematic.
That's because another threat remains.
We are still at the point where our hospitalization rate is going up.
New federal modeling suggests a large increase in new daily hospital admissions for each province due to the spread of Omicron. Already, Ontario alone has over 3,600 COVID patients lying in hospital beds. And with so many people still becoming infected,
even the downside of this curve could be considerable.
To put that in perspective, during the peak of the first wave, just over 3,000 Canadians were hospitalized with COVID across the country. The second wave hit over 4,700. This week, COVID hospitalizations were approaching 7,000 patients.
Being at the peak of a mountain still means you're very high up. So it's still going to be a while before case counts really start to fall, and it will be longer still until the hospitals really starts to empty out.
Before that happens, frontline doctors fear the worst.
I'm worried about our system being so stretched that we could get to the point about choosing who gets care and who doesn't get care.
With children going back to school in most provinces, the battle against this variant isn't over yet. Experts insist Canadians should get vaccinated and continue following public health guidelines in order to safely reach this finish line. Christine Birak, CBC News, Toronto.